Okay, I'm sorry to interrupt you conversation. Today we have a battery in the mic, so maybe it'll work, but I'm notified by the projector that the bulb is about ready to burn out. So, I'm working on that. Okay, today we're going to talk about the rostral brainstem, and this is going to be sort of mid-pons or quadrant middle pons up to the brainstem, up to the midbrain. And we're going to deal a little bit with the midbrain diencephalonic junction. Now, you remember that we said yesterday, I think it came out in class, that there's an abrupt turn. Dr. McCauley has mentioned this thing that at that junction, there's an abrupt turn in the long axis of the nerve tissue. So that in the brain, the long axis in the spinal cord is this way through the brainstem and bends just ever so slightly and goes up to the brainstem, a long axis. And then at the midbrain diencephalonic junction, it abruptly turns so that the long axis through the hemisphere is this way. So that changes how you think of things in terms of relationships of one thing to the other. And we'll try to emphasize that a little bit. Of course, we'll answer questions if you have any. Okay, please review the objectives. I think these are available to you. Okay, a 71-year-old man is brought to the emergency department by his son. The history of the current event given by the son reveals that the man's son became weak on his left side while working in his shop. The examination further reveals that the man's tongue deviates to the left on protrusion. His face droops slightly on the left side, and when he says "ah," the uvula deviates to the right. So, we'll talk about this a little bit later. So we have now a combination of things that are all reflecting motor issues. So we'll talk about it in a minute. Just a reminder, again, I know you've seen these before, but just another reminder, we're still talking about issues related to alar and basal plate. In the spinal cord, it's sort of organized this way with the alar plate up here, basal plate down here. But then when you get into the brainstem, it changes because the ventricles show up, the cerebellum shows up, and the alar stuff goes out laterally, the basal stuff comes here, and the arrows represent the fact that the alar basal plates are giving rise to other structures. That's all the arrows represent. This illustrates one thing, that the pontine nuclei, which are actually located medial to the brainstem, originate from the alar plate. There are a few exceptions to this, and we're not going to get into the exception. I just want to point out that's why the blue stuff seems to be coming down. The other thing that's kind of interesting, if you think of the alar plate as receiving stuff, stuff that's coming into it, and that stuff then is going to be processed and distributed. You see here, we have a big chunk of the alar plate that's migrating up, and that will become the cerebellum. So the cerebellum largely originates as a derivative of the alar plate. Now, why is that? Well, in general, we can say this. The cerebellum receives lots of incoming stuff. Some of it in anterior, posterior spinocerebellar, dorsal spinocerebellar tract, and anterior spinocerebellar tract are coming from the spinal cord. So they're receiving true sensory information from the body. Other parts into the cerebellum are coming from relay nuclei within the brainstem, but it's still information coming in. The cerebellum coordinates motor movement and makes it work. It does not do it on its own. It does it in concert with this incoming stuff, communicates to the motor cortex, which communicates back down the brainstem and back to the cerebellum. Okay, everybody sort of follow that. So we can look at that as a reason why the alar plate would give rise to the cerebellum pretty much as a whole. All righty. I know you've seen this. I've been beating this dog to death. But again, I want to emphasize that these nuclei are easy to understand if you realize sort of the more medial ones are doing motor stuff and the more lateral ones are doing sensory. Now we're going to sort of review this area right here, and then we're going to go up to the brainstem. You can see once you get away from the pons medulla junction, you don't have much in terms of cranial nerve nuclei, but you still have all the motor and sensory tracts that we've been talking about. So those are retained. And also, this is the pons part, and medulla, so on and so forth, and you can see that how they are distributed within that part of the brain. The other thing is, please recall, as we go up the medulla from the junction right here with the spinal cord is kind of small and round, and then it slowly gets larger, and then in the pons it's even a little larger. So there's going to be a shift of these nuclei as they go upward through these parts. But the basic relationship of motor stuff being medial, lateral stuff being, or sensory stuff being lateral, stand, and the sensory stuff is always lateral to the motor stuff. And the reason I said it that way is we're going to see the motor nucleus of the trigeminal nerve is really lateral in the tegmentum, but more lateral in the tegmentum is the principal sensory nucleus of the trigeminum. So the concept of medial lateral is retained. And we have a couple of nuclei in the midbrain. Now we're going to look at several slides here just to kind of review the situation. This is the dorsal side of the brainstem. We have a facial colliculus with the fibers from the seventh motor nucleus and the abducens motor nucleus located in it. There's a part of the ventricular system in the medulla, a big part in the pons. Here we have a sixth nerve right here, a seventh nerve right here, a trigeminal nerve right here, and coming around from the dorsal side of the brainstem, exiting immediately caudal to the inferior colliculus is trochlear, and it wraps around, and it comes out here, and it serves a muscle, an extraocular muscle. And of course we have the pons, which is really large, and now we're going to look at the midbrain. Notice that as we get at the midbrain pontine junction, the structures that are related to the midbrain flare out because they are going to be, they contain fibers coming from the hemisphere and above, and that junction with the diencephalon is along the caudal edge of the optic tract. Caudal edge of the optic tract. In other words, optic tract is diencephalon, the crus is mesencephalon. Well, and also midbrain. Hemorrhoid bodies, which are part of the diencephalon, interconnector fossa, which is part of the midbrain. Everybody okay? Okay, let's go again. Now, again, just to remind us that most of the cranial nerves come at the pons medulla junction or from the medulla. Trigeminal is the only one that comes strictly as a, oh yeah, I'm sorry.
Can you just speak up, please?
Can I speak up?
Yes, please.
I thought our mic was going to work a little better. Okay, I'll speak up. As long as you know I'm not yelling and screaming at you, okay? We understand that, right? Okay. There are three cranial nerves at the pons medulla junction, which we've talked about. 6, 7, and 8. 6 is motor, 7 is mixed, 8 is purely sensory for our purposes. Then we have other cranial nerves coming off the medulla. So most of the cranial nerves, a big bunch of them, are located in this fairly small part of the brainstem. We have 5 up here, which is considered a cranial nerve of the pons, although it has central nuclei that extend all the way up and down through the brainstem. And that makes the central part of the sensory part of the trigeminal nerve kind of unique. Here we see the third nerve right here, which again is in line with the exit of 3, exit of 4, exit of 6, exit of 12, all motor. Here's the trochlear, and we'll come back to trochlear in a minute. So we have exit of these cranial nerves, we have facial colliculus, basilar pons, which is all this area here. It is better to call that the basilar pons because when you look at it, you see none of the tegmentum of the pons. You're looking only at the basilar pons. You can't see the tegmentum because it is inside. Oh, I should mention the striatum medullaris. This very prominent thing right here is the striatum medullaris of the fourth ventricle. And years ago, it used to be thought that they were related to the 8th nerve. And they were called the acoustic stria. But that changed when people found out through research that they had nothing to do with auditory sensibilities. So they changed the name to the striatum medullaris, plural, Latin plural, because there are a whole bunch of the fourth ventricle. And you're looking in the floor of the fourth ventricle, we consider the rostral end of those fibers, the rostral extent of the medulla in the fourth ventricle. Okay, and facial colliculus, and we did look at the hypoglossal trigo, and you can see those in your atlas, they're very small places, hypoglossal and vagal trigo. They refer to the superficial position of the motor nucleus of the hypoglossal nerve. That's what that means. Trigo is a little triangle shaped area. And we won't test you on that trigo, okay? So let's look here just for a minute, which is the caudal part of this junction of the pons and the medulla. And this is what we saw, an abducens nucleus, motor facial right here, abducens, a little bit of motor facial right in this area here. And we see the root of the abducens nerve going down, 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 right lateral to the cortical spinal tract, and then it exits about right here through the edge of the pons. Facial nerve is right here, a little bit of it right here, and a little bit of it right here, and it goes out and exits right at the back end of the pons in about that position. Now here's the spinal trigeminal tract, spinal trigeminal nucleus, vestibular nuclei here, all derivatives of the alar plate, all laterally located. And they, in this particular section, you can see there's the sulcus limitans, there's the sulcus limitans, the fourth ventricle, a remnant, if you will, of the sulcus limitans of the developing embryo. And of course, the line separating alar and basal in general does not go this way. See, it goes out this way, recognizing the fact that as the alar plate rotated out, the sensory stuff rotated out. So the line is not a straight up and down line through the brainstem, it's an oblique line. This is the medial longitudinal fasciculus, which we have mentioned several times. At this level of the abducens nerve, from that level caudally, and there's an MLF in the spinal cord, it goes all the way down the spinal cord. From about the level of the sixth nucleus caudally, all the fibers, or the majority of the fibers in the medial longitudinal fasciculus are descending. From this level, approximately, we're not going to ask you a question on really close to it, generally from the level of the abducens nucleus rostral, there's a lot of the fibers in the MLF are ascending. And I think some of that will come out when we talk about some of the functional systems a little later. It's actually a fairly important track.
Dr. May,
Yes, ma'am.
can you repeat that, please?
Which one?
The caudal portion of the rostral.
All of it?
We can't hear you back here, your mic's not on. Okay, well, it's not on loud.
Oops, I'm sorry. Can't talk too fast. Do you hear me if I do this? Okay, well, okay, it's got a new battery. I'll just try to speak up, okay? So y'all just fuss at me if you
No,
can't hear me.
just yell at us back here, we're good.
What's that?
Just yell at us back here, we're good.
Okay. I'll yell at them back there and ignore you guys, okay? What was I talking about? The medial longitudinal fasciculus, okay? From this level, caudally, you understand what I mean by that? Going down the medulla and down the spinal cord. The majority of the fibers are descending, going from someplace in this area down. From about this level of facial colliculus / level of abducens nucleus, from this level up, many of those fibers are ascending because this tract conveys information down the spinal cord, and this tract conveys information from parts of the brainstem up, and particularly to motor nuclei that move the eye. Motor nucleus of 6 moves the eye. Motor nucleus of 4 moves the eye. Each of them are innervating one muscle. And the motor nucleus of 3, oculomotor, moves the eye in a bunch of different directions because they're innervating a bunch of muscles. So it's an important pathway throughout the brainstem for reflex. Okay. Now, one thing I want to draw your attention to is this right here, medial lemniscus. Remember, it was this way in the medulla. It was vertical, right adjacent to the midline. And the lower part of that vertical piece was the map for the lower extremity, and the upper part was the somatotopic map for information coming in from the upper extremity, okay? So there's a map in the pathway as well as in the nuclei. When it starts to shift, move out this way, and it starts to do that because the new things are coming into the tegmentum, and it's got to get a little bit out of the way. The lower extremity shifts out lateral, and the upper extremity becomes medial. So the map follows along in the change of the position of the medial lemniscus. The information is the same, it's just it follows as the lemniscus changes. Why do we care? Well, we'll see in a minute why it's good just to know about that. Okay, root of 6 right here, root of 12 right here, sensory areas, motor areas, and of course with reticular formation, we're not going to give any details of the reticular formation. Remember, it just as reticular formation. Found mainly in the medulla and pons. Now, having said that, and don't write this down, okay? Promise me, don't write it down. There's a reticular formation in the spinal cord, throughout the brainstem, and into the forebrain. But we ignore that. We just mention it here only in medulla and pons. Question? One thing here on this little map here, notice the motor nucleus of the facial nerve is here. The fibers from that nucleus come up, they wrap around motor 6, and this is part of them right there, right there, right there, right next to medial lemniscus. They wrap around 6 from caudal to rostral, and then they exit in their intermediate position at the pons medulla junction. And they pick up some fibers here from the superior salivatory nucleus that are visceral motor fibers and go out with it. Okay, question. Now we're going to look at a little more rostral pons. This is represented this right here. This section right here represents this, and this section is about at the level of this. And the only thing I'm going to show you here, there's an artery right there, right on the midline. Big one. What is it? Right there. What is it? Somebody tell me. Say again? Basilar artery, correct. Remember that drawing that you looked at? Basilar pons, big basilar artery, there it is on the midline. The relationships are all the same. This is the root of the trigeminal nerve right here, and right there coming off. So it goes through the subarachnoid space, and then eventually distributes, or collects information, I should say, sensory information, from the surface of the face on the side of this nerve, the right side in this case, and from the oral cavity and from the teeth. When you have a toothache, goes through the trigeminal nerve. Now internally here, the tegmentum is right here, this area right here. We have a medial lemniscus. Now it is horizontally arranged with the lower extremity representation more lateral and the upper extremity more medial. The ALS is located right out here. It's in green and right in that area there. And one thing I want you to notice is, as this change has taken place in the medial lemniscus, the relationship of the medial lemniscus to the ALS has changed. Remember, in the medulla, ALS was way out lateral and had no relationship to medial lemniscus. Everybody follow? So, if you had a problem, or if an individual has a problem, and they have both they have medial lemniscus and ALS, and you can talk to them, they don't have a problem in the medulla, because to get both of those tracks in one problem, you have to have one half of the medulla going. And they're going to be probably not conscious, because the medulla is doing things like telling your heart to beat, your medulla is doing things like telling your intercostal muscles to move and bring air into your lungs. So there's probably many more problems than worrying about sensory deficits. That's an example of hierarchy in things that happen to individuals. Okay. Again, we have reticular formation here, this area right here. And corticospinal tract, of course, is still in the basilar part of the pons. It is always in that location. And it sometimes will have a relationship to cranial roots depending on the level that you're looking at. If you're looking at caudal pons, it could have a relationship to the sixth nerve. If you're looking at some other place in the pons, another nerve, and corticospinal fibers can have a relationship to the third nerve through the crus cerebri, because the third nerve exits the ventral part of the mesencephalon. Okay, so here is the dark color right here represents the motor nucleus of the trigeminal nerve right there, and this one represents the principal sensory nucleus of the trigeminal nerve. The motor nucleus is self-explanatory. It removes the muscles of mastication. You put your hand up on your cheek like this and grit your teeth together. You feel a muscle, that's the masticatory muscle, plus several other muscles. The principal sensory nucleus, you can think of that as the proprioceptive nucleus for the trigeminal nerve. The position sense nucleus. An example I gave you before, I'll give again, is you eat your grandmother's really delicious jelly that has all kinds of little tiny seeds in it. One gets between the teeth. You don't perceive pain. You perceive pressure. And what the pressure is from is the tooth moving slightly in the joint, and there are special receptors around the root of the tooth that pick up that pressure, that movement. You take the seed out, bang, it goes away just like that. But there's no pain, no pain. Now, if you crack your tooth, that's a different pathway. And that's going to hurt. But if you crack your tooth on your grandmother's jelly, there's something wrong with her jelly. I think grandmothers are always highly thought of. They make all this delicious stuff. Always nice to go to grandma's house to eat her food. Now we go to the rostral pons. Things are pretty much the same. That's actually a little bit of the trigeminal root right there. The basilar pons, once you get sort of in the rostral part, the more middle part, the basilar part is really big because there are lots of nuclei there. They call pontine nuclei. There's the corticospinal fibers, which we had before, and the tegmentum is fairly small, right in this area here. The pontine nuclei are a source of information to the cerebellum. Remember I said the cerebellum doesn't do sensory or motor stuff, but it receives afferent fibers. And that's one source of afferent fibers with the cerebellum. We'll talk about the cerebellum in a week or so. Now I want to point out here the fourth nerve, right there. The nucleus of the fourth nerve is located at the level of the facial of the inferior colliculus. It is located immediately superior to the medial longitudinal fasciculus. As a matter of fact, it looks a little bit like an egg in a nest. The nest being the MLF, the egg being the nucleus of four. One muscle is innervated. But what happens is the fibers come out and they wrap around, they cross the midline, and then they exit on the opposite side. Damage to the root of the trochlear nerve gives rise to a weakness of that muscle on the side of the damage. Damage to the nucleus of the trochlear nerve, and this only applies to this particular cranial nerve. Damage to the nucleus of the trochlear nerve would result in weakness of that muscle on the opposite side. It's kind of a fine point, but I think it's just good to understand that, because we have told you that all cranial nerve motor nuclei are talking to skeletal muscles on the same side, and this is the exception. It's innervating the muscle on that side once it gets out of the brain, but you have this unique situation of it's coming from a nucleus on the opposite side. This is the periaqueductal gray right here, the caudal part of it. This is the cerebral aqueduct right here, and we will, we see that once we get into the brainstem, especially in the midbrain. This is a very prominent structure and has this relationship to the cerebral aqueduct. Now here's the medial lemniscus we would follow. Now remember, it started here vertically into the medulla, then it kind of turned this way as it went from the medulla into the caudal pons, and then we get into the mid pons, and now it's flat out this way. But the somatotopic map is the same. Upper extremities here, lower extremities here. The anterolateral system is right here. So you see there's a real close relationship between medial lemniscus and ALS, but only we find that only starting at about mid-pontine levels and going rostral from there. Yes, you have a question? Everybody get that? Medial longitudinal fasciculus right there. Look how small it is, very compact, always located adjacent to its buddy on the midline, whether you're in the medulla pons or midline. And of course, we see here the inferior colliculus and the superior colliculus. Let's see. So the only other cranial nerve nucleus that we would have in this area right here is a real tiny one right here, which is part of the trigeminal system. It is located lateral to the right in this area here, right at the interface of the surrounding brain with the parietal cord, and it is called the mesencephalic nucleus of the trigeminal nerve. Mesencephalic. What does the name tell you? Where is it primarily located? Midbrain, mesencephalic. A unique thing about the mesencephalic nucleus is all the sensory nuclei that are concerned with cranial nerves have a ganglion in the periphery, somewhere in the head. In the case of the dorsal motor nucleus of 10, it's a ganglia throughout the body, because the 10 gets stuff from a lot of the body, especially the men in the gut. So the mesencephalic nucleus has the unique feature of having unipolar cell bodies, which are sensory cell bodies. Those are found in all ganglia, spinal and cranial. Of having unipolar cell bodies in the mesencephalic nucleus. Sorry if I stand in front of you. Get out of the way. The cell bodies right along here are unipolar. They come get information from the periphery. There's no ganglion. They don't have a ganglion with cell bodies in it. The cell bodies are in the mesencephalic nucleus. So we commonly will call it the mesencephalic tract and nucleus. Those are all together. This particular part of the spinal system is related to, among other things, related to reflexes. For example, you're eating a bonbon, and it's a cherry bonbon or something. My wife would like that example. And you bite down really hard because all the other ones you ate didn't have a seed in them. You bite down really hard, and bang, the teeth come onto a seed. Do you keep biting? No, you instantly stop. So the mesencephalic nucleus sensed this and immediately inhibited the contraction of the muscles of the jaw. So the tooth is most likely preserved. Years ago, I was at the Medical College of Virginia, and I had a box of cherries, chocolate covered cherries or something. And I was munching them, had them in my office, and I would eat one every once in a while. And that exact thing happened to me. I bit down on a cherry because they were all no seeds, and all of a sudden, whoa! You know, my jaw just kind of jerked. So fished the seed out, and there was a seed in the cherry. They had not gotten that one. So I wrote a letter to the company. Not a nasty letter, just kind of a funny letter about I wasn't counting on this bonus, and I got a real nice letter back and a box of samples of all their stuff. So, but I didn't eviscerate him. I just said, there was not a counting operation, it's a surprise, a bonus. Anyway, but the misspelling nucleus is involved in that type of reflex to preserve the teeth. Okay. Somebody asked me about the central tegmental tract. There it is right there. It is in the tegmentum, central tegmental tract, but it's not a nucleus, it's a tract. And it's really, you can think of it as a descending tract that conveys a whole bunch of information down to other parts of the brain. But I don't think we'll spend a lot of time on that. Okay, now the only other thing we'll mention here are the striations that go across the midline. The black are fibers, the white areas are nuclei, and these are, in general, almost all of these are pontocerebellar fibers. From the pontine nuclei going into the cerebellum. Very common. Pontocerebellar fibers. All right. Blood supply. What vessel is that? Pontine, you know. It's actually that little groove right there is called the basilar groove. So it's convenient that the basilar artery sits in the basilar groove. That's convenient. Now, the basilar artery gives rise to three sort of classes of vessels, and that's all we're going to do, just these three classes. Paramedian branches, which come close to the mid, or serve the midline on either side. Para alongside the median plane, paramedian. And these would be sort of like the interspinal arteries in the development. Now, one thing I want to point out here, because we've already mentioned this represents the level of 6th and 7th nucleuses right here. And so we're at the caudal end, or we're at the caudal aspect of the pons that we're going up. And the medial lemniscus, which was right here, now is shifting out. So I draw your attention to this, that this structure of the medial lemniscus in the basilar pons is shifting from one vascular territory into another vascular territory. And that second vascular territory will be short circumferential branches of the basilar artery, which is right here. So you can see it will go over, and eventually the lower extremity will get into that territory. And then the third general class of vessels for the basilar artery is the long circumferential. And circumferential just means going around. So you have short ones, short circumferential that go out here, go out here. The territories are drawn here, they're just all not drawn here. And long circumferential, which go around and serve the most lateral part of the basilar and tegmentum of the pons. So the medial lemniscus can shift from one vascular territory to another, and then depending on the individual, can shift into a third territory, where the lower extremity ends up being sort of way out in this area here. The other thing too to notice is parts of the trigeminal complex can be in this territory, and so that would be a blood supply to part of the trigeminal side. As it goes through the brainstem, the long tracts will change their blood supply. For example, the corticospinal starts out in the posterior limb of the internal capsule with one blood supply, goes into the midbrain with another blood supply, goes into the pons with more different blood supply, goes into the medulla with more different blood supply, goes into the spinal cord with yet another version. Same track, same function, everything, but it's just as it shifts, it goes through changes. For example, you're on a trip and you want to have a crystal burger. I love crystal burgers. But you're going through a part of the country that doesn't have crystals. So you have to wait till you get a part that does, then you get your crystals. You want food, you go to a different restaurant. Okay, question? Okay, now let's look at the midbrain. The thing about the midbrain is its junction with the diencephalon is a little dirty. I'll use that term because it's not a nice smooth line. It's a nice smooth line on the medial aspect of the brain here. It's from the caudal end of the mammary body up to the posterior compensatory. That is the junction of midbrain with diencephalon on the mid-sagittal view of the brain. But when we look at other views, for example here, this is the dorsal view, the quadrigeminal body, the four colliculi. We draw a line along here. The pulmonar and the medial geniculate are part of the diencephalon, so the line goes down and goes like that. So it's a little bit of a not a nice sharp line. At this position, you got to remember the geniculate bodies are diencephalon, pulmonar is diencephalon, but the colliculi are mesencephalon, and the little connections into the along here, the brachia, the arms of the superior and inferior colliculi are components of the midbrain going to diencephalic structures. On the ventral surface, we have mentioned the optic tract right here, which is a diencephalic structure, mammary bodies, which are diencephalic structures, are the columnmost parts of the hypothalamus. So you draw a line along the back edge of the optic tract, over behind the mammary bodies, and then it goes on that same way. So this is midbrain here. This is basic pons. So it's not a nice, clean, sharp line on above and below, but on midline it is. Now I think the thing that helps here is if you know the mammary bodies and optic tract are diencephalic structures. Medial and lateral geniculate bodies are diencephalic structures. And anything behind that is mesencephalic until you get to the rostral border of the pons. So important features include, for example, the intraventricular fossa, which is right here. The little holes just represent blood vessels. And this is the crus cerebri right here and right here. It contains the descending motor fibers that influence motor activity. We have mammary bodies, crus, the optic tract, and cranial nerve 2, which is right here. Optic tract, optic chiasm, and optic nerve. You will learn in your visual system lecture that there's important things happen at the chiasm. And some of you may already know that. One eye, this gets information from one eye, that gets information from both eyes. Important concept that Dr. McCauley will stress. So we have the mid-sagittal boundary here. We have the structures here related to, and you can see that midbrain is very short. It is the shortest segment of the brain in adult humans. Over on this side, we have superior colliculi, inferior colliculi, the pineal, which is right there, not the holes, but that structure right there. It is one of the very few midline structures in the human brain. In other words, a structure that there's not a duplicate on the other side. It is truly midline. We have the brachia of the superior and inferior colliculi. The brachia of the superior colliculus runs right over there. The brachia of the inferior colliculus runs right up here. I think there's some nice labels of those in your atlas. Geniculate bodies, which are part of the diencephalon. And the crus cerebri, which we see the edge of here, and you see the edge here. So we're looking down on the crus cerebri, which is shaped this way and this way. There's the edge of it right there, and there's the whole structure right there. So everybody with me on these sort of different looking at these things, okay? So I want to make a couple comments now for things that are characteristic of superior colliculus and inferior colliculus. Here you have a MRI of the level of the superior colliculus right here. And the line comes through the inferior colliculus, which is actually right there. Goes through the cerebral aqueduct, which is represented by the little white dot in the black structure. Through the tegmentum of the midbrain, which is all this right here. And through the crus, which is this right here. And that is the Mickey Mouse of the central nervous system. Okay? Don't write Mickey Mouse on it, but it may help you remember. And we know this is inferior colliculus for mainly two reasons. The colliculi are not so prominent, and there's no hypothalamus here. See, there's no hypothalamus. So we are at a plane of section below the hypothalamus. Characteristics of this level are the decussation of the superior cervical peduncle, the decussation of the superior cervical peduncle, the inferior colliculus, as I said, and the motor nucleus of the trochlear nerve. Those are characteristic of sections through this, and you can see those very easily in lab. And of course, we have the same tracks going through. We have ALS, posterior column, medial MLF, and cortical spine. All the same tracks are going through. And those don't show up in detail here. There's cortical spinal right there. There's the decussation. There's motor fourth. There's the inferior colliculus. So the red nucleus is not here because the decussation is in the way. The red nucleus will show up in this position once we get rostral to the decussation of the superior cervical peduncle. Okay, now let's look at the superior colliculus level. Now we see something that's like this right here. Here, it's the same thing. Same shape, and within that shape, the tracks are always all at their same location. So we would have cortical spinal fibers right here, medial and meniscus fibers right in this area here, ALS right out here, and the motor nucleus of the third nerve is right here, just ventral to the periapical brain. And on this one, the pink fibers represent the both rostral end of the mesencephalic tract and nucleus, which goes all the way through the midbrain. So here we see the line right here. Superior colliculus, right here, so kind of bulging up in contrast to the inferior colliculus. Cerebral aqueduct, again, the black hole. The tegmentum right here, which is right here, and the central part of the tegmentum is the positions of the red nucleus. The decussation of the superior cervical peduncle is gone. It is caudal to it. So now we have the red nucleus. And you see this part right here of that line, it has hypothalamus. So instead of going under the hypothalamus, we are now going through the hypothalamus. So we have things like the mammary bodies, optic tract right here, and right here. Hypothalamus, actual substance of the hypothalamus right there, which is right in this area here. And the space right here, which is the lowermost part of the third ventricle. So we have third ventricle, subarachnoid space and rostral for that because there's a little border right there. Third ventricle, hypothalamus, mammary body, and a little bit of the intraventricular fossa, but not much. So this is part of what we see in the transition from midbrain going into diencephalon. And you can check these are pretty much the same. One thing we do want to point out, substantia nigra right here will be black on all of your specimens in lab, and it is black on all of the specimens in your atlas. Substantia nigra, the nigra plus the crus cerebri. The nigra plus crus cerebri, all of this is the basis pedunculi, the base. So it has a homologous relationship to the basal pons. We have a basal pons which has fibers and nuclei. We have a basis pedunculi which has fibers and nuclei. Fibers being everything in the crus, nuclei being the substantia nigra. And then from the inside of the nigra right here, all of this up to right here, this is all tegmentum. So that's the tegmental part of the midbrain, as we have a tegmental part of the pons. Cerebral aqueduct, as we said, is right here, and periaqueductal right here. And superior colliculus right here, and of course superior colliculus right here. Space above the superior colliculus, right there, is what? What is that space? Quadrigeminal system. Everybody with me? Quadrigeminal system, right there and right there. Now, why is it called quadrigeminal system? 4 bodies. What are the 4 bodies? 2 superior colliculi and 2 inferior colliculi. 4 bodies. Again, I say that, I give that example to emphasize the fact that the words we use usually don't usually mean something. Usually. through a sample of the midbrain. Okay, this is the level of the motor fixation of the cerebellum, right there. Median MLF, trochlear nerve, trochlear nucleus, and the inferior colliculus, the crus and nigra right here. So through the inferior colliculus, the central part of the section is taken up by this very large bundle of fibers crossing the midline. Okay, we go up here, we've lost the bundle, but we have Mickey Mouse's eyes, which are the red nucleus. And we're collecting parts of the diencephalon right here, which is medial geniculate, a little bit of the pulvinar nucleus, which is really big. Motor nucleus of the third nerve, superior colliculus, and red nucleus are all characteristic of a cross-section through the midbrain at the level of the superior colliculus. And the section is tilted slightly. One thing I should say, that right there is a missing part of the cortical, it's missing the cortical spinal cord. Now, vascular territory of the midbrain is, again, not as clean as the vascular patterns throughout the brainstem. This is the posterior cerebral artery right here, and this has branches coming off and going in. There's a quadrigeminal artery right here coming off of the first segment of the posterior cerebral. And it goes around, and serves the tectum, which is the roof of the midbrain, tectum. And it is called the quadrigeminal artery because it serves the four bodies. Okay, there's one on each side. And it also, as it bypasses, it also serves some of the lateral part of the midbrain. Superior cerebellar artery is that one right there coming off the basement. That's all the way around. Gives a little bit to the inferior colliculus, not a whole lot, and then passes on to serve the cerebellum, superior cerebellar artery. And there's also some branches that come off of the second segment of the posterior cerebral that go in. I think we'll talk about those a little bit. This is to illustrate the ALS is out here, the ALS is out here. This is to illustrate the position in the medulla, pons medulla junction, and mid and lower rostral medulla. And then once it gets into the midbrain, the lower extremity is sticking up and out because, remember, the red nucleus came in and pushed everything out. Now, what was a lot of distance between medial meniscus and ALS is now they're next door to each other, and they are in the same vascular territory. Same vascular territory. Okay, I think I put a few slides in here. We'll make it real short to sort of illustrate this long axis change. The long axis of the midbrain is right through this direction. So in other words, you can think about it this way. The midbrain is rostral to the pons. Everybody with me? Rostral to the pons because it's in front of the pons. Whereas the pons is caudal to the midbrain. Okay, I'm not playing a word with you. You see what I did? I picked a reference point. The pons, and then I related something to it. The midbrain, then I related something to it. So the long axis of the brainstem is this way, and of course in the spinal cord which hangs down, the long axis is the same way, it goes straight up and down the spine. Once we get to this junction right here, this long axis abruptly changes, so now it's rostral caudal again. So in an axial view, we're looking at it that way. In a coronal view, we're looking at it this way. And what we're doing, the axial view is parallel to the long axis of the hemisphere. The coronal view is cross-section of that long axis. Everybody following? Down here, a section like this is sort of axial in the blood, or in the brainstem, but a section like this is rostral caudal in the brainstem. We use terms rostral caudal, anterior, posterior, sort of with abandon because we don't think about this. But if you have questions about those directions, please let us know. Okay, we mentioned some of these junctions right through here and right through here. Where we have the diencephalic structures here, and then we have the mesencephalic structure. In this, here you see the substantia nigra plus crus, and here we see the red nucleus. As we go up, we collect medial lateral genicular nuclei, which are diencephalic structures, pulvinar, and as we go a little higher up in this section here, we see the same structures right here in relation to the crus, and the pulvinar is right here. We see superior nuclei right there, motor 3 right there. And we don't see it here, but the motor 3 nucleus is going to be right in this area here. So if we look at 3 levels, here's the long axis changing, okay, very roughly. If we look at 3 levels, we have a red nucleus, a crus, a little bit of the diencephalon. We go a little higher. We have crus, red nucleus, a little bit of superior nucleus, much more of the diencephalon, and we have collected the optic tract. Because we went up far enough rostral in midway to collect the optic tract, which is laying right on top of the crus, so that's a very accurate rendition. Then we go a little more higher up, and we lose the entire midbrain. We have a pineal, a third ventricle, a centromedian nucleus, a pulvinar, and a ventral posterior lateral nucleus right here, and a ventral posterior medial nucleus right there. So as we go up, we have lost the sort of cross-section of the brainstem. We've collected the axial structures in the hemisphere that it just sort of melds together. And again, ask us about this one. Okay, I'm not going to go over these much, just to say look at them, because these give you an idea of posterior column, medial lemniscus from spinal cord to cortex. And again, we'll talk about these in separate lectures. But I just kind of summarize them here. Here's a summary of the anterolateral system from spinal cord to cortex. And here's an example of corticospinal system from cortex to spinal cord. Okay, what about our man? 71-year-old man is brought to the emergency department by his son. History of the kind of event given by the son reveals that the man suddenly became weak on his left side while working in his shop. The examination further reveals that the man's tongue deviates to the left on protrusion. His face droops slightly on the left, and his uvula deviates to the right. Okay, let me ask you a second question. Again, we see the concept of sudden onset. What does the problem mean? Vascular, right. Vascular lesions of sudden onset. If it's a tumor, it's going to be slow, and take maybe, based on the type of tumor, weeks, months, years. Okay, in this man, what is the best localizing sign or signs? Say again? Okay, corticospinal would not be a localizing sign, because where is it? Cortex, internal capsule, spinal cord. It would be the cranial nerve cell. Okay. Where's this lesion most likely located, or where would you put this problem to get these studies? Where in the brain? Okay. Corticospinal fibers in the crus are located right here, labeled corticospinal. And immediately medial to those fibers in the crus are what are called corticonuclear fibers. Corticonuclear fibers innervate motor nuclei of cranial nerves. And they're all together right here. In this location right here. And here we see a lesion that's involving much of the cruciate brain. Okay, the corticospinal fibers to the hypoglossal nucleus from the right side cross to the left hypoglossal nucleus. Everybody with me? So when you stick your tongue out, the tongue does not stick straight out because it has a weak side on voluntary movement, on protrusion. So you try to stick it out and it will deviate to the weak side. It's the The same relationship for facial motor neurons. The lower part of the face, this area right here, receives input from the opposite motor cortex. So if you're just sitting and looking at a person, they may droop a little bit, but not a whole lot. But if you tell them to smile, they'll go, one side of the face goes up, and the other side of the face doesn't do anything. Again, they make a voluntary movement. Now the uvula, that's the little thing that hangs down in your mouth. Right? You brush your teeth, and I go like this, you'll see the uvula. The uvula is a bit different because it's made up of muscles that are longitudinally in the uvula, really tiny little muscles. When they're weak on the opposite side, that half of the uvula is weak. So when the patient goes, ah, the uvula deviates towards the good side because that muscle is contracting and swinging it up. Okay? And we can direct you to some pictures of these things. Okay. Sorry to go over my a lot of time. Please review these.